People frequently talk about something called post-traumatic stress disorder. That's PTSD. And now there's a even larger conversation around something called complex PTSD. And in fact, the World Health Organization just a couple of years ago indicated that that is a very real diagnosis, even though our own diagnostic and statistical manual, recognized by the American Psychiatric Association, doesn't recognize it, which is very unfortunate because complex PTSD, which aligns very closely with developmental trauma, has very distinct neurobiological markers as well as behavioral symptom presentations. And so I'd like to take a moment and piece these diagnoses apart. Why is PTSD different from C-PTSD or developmental trauma? So in PTSD, we have a single acute encoding experience. Something happens, there's an event, that event has meaning, the landscape is vulnerable, and our system says, oof, this is inescapable, I can't get out. And our lovely little brain links in and says, I'm going to remember this forever so that I can stay safe in the future. Complex PTSD has many, many, many events and experiences that are threatening to the self and to the world and life around us. These experiences usually happen in childhood, which is why we have that developmental trauma component. But somebody can develop complex trauma later in life. We frequently see this in experiences such as war, in experiences where there's traumatic ongoing grief and loss, as well as intimate partner violence. In complex PTSD, there's the symptoms of PTSD. So let's walk through what those are. They're commonly an experience of agitation, hyperarousal, anxiety or irritability, so some mood lability, difficulty. We also see intrusive thoughts, ruminations, and even memories of the traumatic event. It's as though it keeps creeping into our brain and saying, hey brain, remember this, and it's as though we're reliving it. And those types of experiences don't just exist in our waking life. They can even fold into our bedtime and show up as nightmares. So we also frequently see sleep disturbance. We see the system being more highly reactive to trauma triggers, so things that remind our brain of the trauma. Remember that case for trauma and survival we talked about in the previous video? That's exactly what this is. And when a trauma trigger shows up, our brain and our body flip back to that moment of the encoding and go, how did we survive then? We're going to survive that way again. Fight, flight, fawn, and freeze. The 4 F's of trauma show up. Now, when our brain has been exposed to chronic long-term trauma and we do not feel safe in our mind or our body, we start to experience additional symptoms. And this is what differentiates complex trauma from traditional PTSD. The additional symptoms of complex trauma are 1, a lack of safety in relationships, disrupted attachment. We do not feel as though we can trust other people, and that feeling is deeply embedded in our brain and our body. We actually have a little brain part that links directly into that called the periaqueductal gray. I'll talk more about that in a future video. Number 2 is that we have emotional dysregulation. Our brain hijacks us very quickly, and partially because if we don't feel safe in the world around us, our emotions are going to be chaotic and running the show. So we might feel like we're really loving and attached to somebody and then go into a state of freeze or rage or anger very quickly. Our emotions go up and down, and we see that even with mania and depression, feelings of being numbed out, and then high in our emotional experience. And then finally, number 3 is that we lose a connected sense of self. We're not sure who we are and how to navigate the world around us successfully. Our values, our belief systems are not fully designed. We may not even know what we like at a most base level. And all of those 3 things create a very chaotic and deeply painful way of navigating the world, in addition to all of those other symptoms of PTSD. Again, the good news is that healing is possible. And that's what this video series is all about, is how do we help ourselves move through and create new opportunities for proactive healing. And of course, step one is knowledge. Knowledge is power. So that when we've catch ourselves in a moment of having a dysregulated relationship with somebody, if we notice that our emotions are going up and down like this very quickly, we can step back and go, oh, hi brain, you're doing a thing. Okay, and if my brain's doing this, that means my amygdala might be having a little bit of involvement here. And that means that our system thinks there's a threat in the environment. So rather than spiraling into shame, which is a big part of complex trauma, because when we have unusual behavioral difficulties or symptoms in day-to-day life, our brain loves to shame us because we're acting different. Rather than going into shame, we can go into self-compassion.